It happens to a lot of us, especially as we age, noticing something on our skin that maybe wasn't there before.
How do you know if it's something to worry about? Most of us are too busy to get it checked.
Yeah, Nebraska Cancer Specialist is making it easy with a free screening Saturday. Dr. Ralph Hauke is here to tell us a little bit more about that. Good to see you, Doctor.
Good to see you again.
Thanks for coming in.
Thanks for
this
being
is
back.
something, the screenings are really important to identify melanoma. How
Correct.
common is melanoma?
Well, it's becoming a lot more common. The incidence has doubled since the 1980s. It's also, from a danger standpoint, it's the 5th cause of cancer deaths in men and 6th in women. And we've seen a lot also, some statisticians call it an epidemic of melanoma occurring in younger patients. You know, so for instance, in younger than 20 years of age, there's been an increase of 3% a year in the incidence.
What is that attributed to?
Well, the main risk factor is exposure to ultraviolet light. So, you know, exposure to the sun. Really, it's exposure to the sun intermittently and intensely. So you're worse off having 2 bad sunburns in the summer than having, you know, a bit of chronic exposure, which is, for instance, folks who do occupations outside and get occupational exposure. They actually don't necessarily have as high a risk of melanoma because it's kind of gradual and their pigmentation builds up a little bit. But a young kid that goes, you know, to the summer pool only and then gets burnt a couple times, their risk goes high.
Wow.
Yeah, and that's what's so scary about melanoma. I mean, it starts as a little disfigurement of the skin, right?
Correct.
And what seems so small can be deadly.
Right.
What is it about melanoma? Because, you know, you look at other forms of cancer and you say, well, cut it out, take that cancer out. What is it about melanoma that doesn't allow you to do that?
Well, you can cut it out. So that's one of the nice things about it is both the prevention side, if you protect yourself from ultraviolet exposure, but then the identification at an early stage.
The early stage allows you to cut it out. Yeah.
Right. So the issue is that where the melanocytes, which are the cells that produce the pigment and become melanoma cells, they're located at a level in the skin that is fairly close to where you have blood supply and what's called the lymphatics. So any significant penetration of depth gets those cells into an area where they can metastasize, you know, spread very quickly.
So that's when removing the spot no longer becomes effective because it's spread through the lymph system.
Correct.
What are we looking at here? Because these are some of the things that people need to look out
so
for.
these are called, it's called the ABCDE of melanoma, and this is just something that people, when they can actually look at moles themselves. And so the A stands for asymmetry. Most benign moles are symmetric, meaning that they're kind of a similar shape and color. Melanomas tend to be irregular, and you'll see like one patch that's darker than another. The borders, melanoma tends to be irregular, whereas benign moles are smooth and round. We look at the color, changes in color. Benign moles typically tend to be fairly uniform. When you see suddenly a mole that starts getting very black in one area or blue or brown, you know, changing color is important. And then the diameter. The bigger the mole, the more dangerous it is. And then one thing that's been added in recent years is evolution, is noticing a mole that you've had for a long time, if it changes over time, to let, go see a dermatologist or your primary doctor to get that evaluated.
That definitely hits home for me because if you guys have probably noticed, I have 2 very obvious ones that I've had since I was a child. So for those of us who have beauty marks, who are marked by them, I like beauty mark rather than mole.
No,
Just a personal preference.
Yeah.
Of course. No, some of them are definitely moles. But what do you need to look out for? And could those of us that have had things like this for a lifetime, do we need to pay attention to them?
Well, you do. I mean, there's certainly a lot of moles that are relatively, they're going to be benign and they'll be that way for a long time. But there are moles that can be what we call dysplastic moles, which are moles that do have, if you want to call them precancerous potential, that they can become cancerous. And those are particularly the ones that have to be, you have to look out for. There are some familial syndromes where people have these dysplastic moles, and those are individuals that are even at higher risk that can occur as well. So
you talk about the importance of early detection. That's what this screening is all about. We're going to get to those details in a second. But what advances have been made in treating melanoma in those late stages? So
that's been an exciting area in the last 5-6 years, I'd say. We have melanoma is one of the cancers that typically has sort of a prototype cancer that responds to immunotherapy. In other words, the immune system for some reason tends to be very better at attacking melanoma than other types of cancers. And so we now have a slew of new drugs that have been approved in the last 5 years that help boost your immune system to fight the cancer better. as well as we have vaccines that we're injecting directly into melanoma tumors that can attract the immune system to that. So it's really an exciting time. It's still a dangerous disease, but we're really starting to make some exciting inroads, and there's just a lot of exciting clinical trials that are going on with that too. So.
Well, if you have any spots that you're curious about, there's no need to Google and compare or ask a friend. You can go down and get them checked out for free coming up on this Saturday. What should people know if they want to attend? Anything they need to do, bring, pre-register?
There's if you go to our website, there is a place where you can check in and appointments. I think we're actually full on the scheduled slots, but walk-ins are certainly welcome.
Great.
We've got 4 dermatology practices that have volunteered to come out, and so we've got a good handful of folks, and so so if you can call, register, we'll try and accommodate folks in, but just show up on
register if you can. Nebraska Cancer Specialists, and it's a free cancer screening. It's at 172nd and right, and that's in the Village Point area on the Village Point West.
No, it's actually by Legacy Shops.
Okay,
south
this
of
is
Lakeside.
Legacy, yeah.
Yeah, and so it's up behind, if you know where Upstream Brewery is, it's up
Yes,
just
up behind,
southeast of southwest of that corner there.
Yeah,
so 9 to 1 o'clock on Saturday.
On Saturday. NebraskaCancer.com for all that information. Should be up there. Dr. Halke,
Perfect.
thanks for coming in.
Thank
We
you.
appreciate it. Sorry about the turkey feathers
Okay.
and everything else that came
Should
along
have
with
served some turkey.
it. Don't say that too loudly.
Interesting information.
Get Mom the gift she